So here's the thing. I'm going to do this no matter what you say, but I do want to give the air of, doing my actual own research. So I guess I'm going to talk to you. I'm at my doctor's office now. I know you're the pharmacist here and you talk about weight loss stuff, but I want Ozempic. So can we talk about this? I've read about it on TikTok. I've watched it on YouTube videos. That's how I do my research. And, that's where I get all my medical information. So can you, I guess, explain it to me? And I will be listening reluctantly.
Of course. Yes. So, yeah, Ozempic is a medication that has been out for several years, that's approved for type 2 diabetes.
Okay. I don't have
So,
that.
so it works really well with the body to help regulate how we digest food and regulate blood sugar so that we don't see these big blood sugar spikes after people have meals.
Hmm.
So the FDA studied it specifically for type 2 diabetes in order to get that control so that with people that have diabetes don't have organ issues in the future and kind of to really regulate that blood sugar. A lot of times people see it in the news because what happens when people start on Ozempic is they do have some weight loss associated with it.
Oh, that's what I'm
Um,
after.
Weight loss is a great it's advantageous for people with diabetes and people without diabetes. But Ozempic specifically is really only indicated for those that have a diagnosis of diabetes, which really comes from lab values. So if your blood sugar has been high in the past, or if you've gotten a lab called an A1C that showed that your average blood sugar readings have been elevated for the last 3 months.
Yeah, no, I mean, I don't have diabetes at all. I just like the idea of being able to stuff my face and then lose weight. And so everybody's talking about Ozempic. Um, so if I don't have diabetes, can I just get Ozempic? I mean, I'm hearing about people getting it all the time.
So because of the benefit that was seen with Ozempic, the manufacturer actually remarketed or reformulated the medication into a different medication, which is called Wegovy.
Ooh.
It's the same active ingredient, which is semaglutide,
Hmm.
and they took the benefits of what we were seeing in the patients with type 2 diabetes, where it was regulating the way people were eating, reducing cravings, reducing appetite stimulation, having the food sit longer in the stomach, and it was reformulated into this medication, which is brand name Wegovy. It is FDA approved for weight management, but you do have to have specific weight cutoffs. So that's specifically based on BMI. So if you have a BMI over 27 with comorbidities such as diabetes, high blood pressure, high cholesterol, or a BMI over 30, which is considered obesity, those would be people that could potentially be considered for Wegovy. But there's a lot of other things you want to consider first. The medication's really only going to be beneficial if you've tried other lifestyle modifications in the past. So if you've tried diet and exercising, lower calorie reduction, low fat foods, those types of people that still can't lose weight after doing those type of lifestyle modifications might be a candidate for the medication. But you have to keep in mind that it's not a magic bullet, right? If you continue to eat a lot of high fat foods, a lot of foods while you're on this medication, you're not going to feel so great because that food is sitting in your stomach for longer. So it can cause some gastrointestinal types of side effects, things like nausea, vomiting, diarrhea, constipation. So it's definitely something that needs to be done in association with lifestyle modifications. It's not just going to be a medication that you can take to automatically lose weight.
I mean, I've tried everything from not changing my diet to not changing my exercise. I've even tried all of the different supplements over the counter and I still haven't lost the weight. And I know you're looking at me going like this guy could probably be an underwear model and but I am actually as a real piece, I have a BMI that's in the obese range. The only reason that people are like, what? My BMI is like 30.2. And it's, the reason that people don't get that vibe from me is because the only thing I do all day is suck in my gut. That's the reason I have abs is because of just holding in my stomach all day. But yeah, so I mean, I hear that you know what you're saying is that you have to do the lifestyle stuff 2. And one of the big problems that I feel is that when you take this stuff, if you stop it, all the weight just comes back, and that kind of stinks. But I guess it's worth it to take it all the time. So, I guess you're saying, so this Wegovy, is that like, so I know Ozempic's an injectable, and I don't really want to stick myself, but I guess I will. I mean, I technically would take a suppository of this stuff twice a day if it made me lose weight. So, is Wegovy injectable?
Yes, it's this similar type of injectable, a once weekly injectable. It is a different type of pen, so it's an auto injector.
Yeah.
So it does make the injection more simple. The pen does a lot of the work. You really don't even see the needle at all, but it is a once weekly subcutaneous, so that just means right under the skin, pretty small needle. Can take it without food, choose the day of the week that you would want to do it. So very similar to the Ozempic type of injection.
So it kind of sounds like to me that you're really hesitant to give Ozempic to somebody like me, or Wegovy to somebody like me. But all I'm hearing about are people just getting this stuff left and right and having all these great results. So what's up with that?
I think that's always been the search, is people looking for this magic medication to lose the weight. And this is one of the first medications that we're seeing better safety profiles. We're seeing some better effectiveness for weight management. The previous medications that we had were stimulant types of medications that would increase your metabolism and have your heart race and have risks of high blood pressure. So now that we're seeing these medications that really work in a smarter way with the hormones in the body to regulate how we respond to food and how the kind of cells work to digest food, it is a smarter way to do it. So I think because it is safer, we're seeing 10% body weight loss
Oh,
on these
all right.
medications. It gets picked up in the media.
Yeah.
But I think the part that does often get missed is who's the best patient for it to be used in, what are the side effects associated with it, and then who shouldn't it be used in? Who should we definitely avoid these classes of medications? And because there's always going to be contraindications or specific people or past medical history that it's just not an appropriate therapy.
Well, I mean, who would fit into that category?
So anybody that has already slowed down digestion, so gastroparesis is the medical term, but any person that has trouble digesting food, it's going to make it worse. So we wouldn't want to use it in those patient populations. There is also a warning of pancreatitis. So with all of these medications, there is a warning that it can cause that inflammation of the pancreas. So if there's any history of pancreatitis in the past, we wouldn't use it because we don't want to risk that happening again. And then there is also a warning for a specific type of thyroid cancer. It's very rare, but if you have a personal history or a family history of this specific type of thyroid cancer, it would also be not an appropriate medication to use.
Got it. So I heard a lot of big words there, but I also heard 10% weight loss. So, I'm not going to take the COVID vaccine because there was 7 people that had a problem out of the billions of shots that were given. But, pancreatitis I'm okay with. In fact, I listened to this podcast, Wellness Upside Down, and he talks about how turmeric has a 5% hepatotoxicity risk. But you know what? I heard it's good for inflammation, so I'm going to take that instead. I'm really good at math is really what this comes down to. So, all right. So you're saying all this great stuff. But again, I'm hearing that people are getting it left and right. So why is it that your office is giving me such a hard time in getting this thing when I can just, how are people just getting this drug without even talking to somebody?
Yeah, so unfortunately, what happened last year is that there was a major back order on Wegovy, the weight management medication. So what had happened was, because it's the same generic drug product, semaglutide as Ozempic, it was being substituted. When the drug manufacturers come out with a medication, they kind of guesstimate how much drug to create based on the number of patients that have the disease state. Since Ozempic was indicated for diabetes, they only formulated enough for patients that have diabetes. So unfortunately, what happened was that it got out in news. I know it was on TikTok. A lot of celebrities were using this for weight loss medication. So people started asking for it. And because there's data with semaglutide for weight loss, practitioners began prescribing it off-label for that use. And unfortunately, what happened was that the supply ran out because they weren't making enough for people to be using it off-label for weight loss. They couldn't keep up with the demand. So patients that were using it for diabetes to control these chronic diseases, to keep their sugar within a low range so that they didn't have to have hospitalizations or worsening of the disease state, couldn't find their medication. So that was a huge concern. Even more scary is other places are popping up that are advertising semaglutide. The manufacturer has come out and said that they have not justified using the generic off-label for weight loss anywhere. So the question is, where are people getting this generic semaglutide from, whether it's these med spas or other places that are advertising it for weight loss? So that's something that you definitely need to think about. You don't know what they're injecting into you. It doesn't have any approval for being used that way. So unless it's the medication that has been prescribed by the provider that you're getting from a validated pharmacy that's been FDA approved, it's something that needs to be used definitely with caution or likely not at all.
But don't you think that like all that stuff is just about making money, like these high cost drugs and the pharmaceutical companies? Don't you think that's a profit driven thing? And like the people that are doing it cheaper, aren't those folks better?
It's tough because these medications are really expensive. The United States is one of the countries that has the highest cost of medications, and a lot of times it's justified of they're the ones that did the research and development that they need to have this cost of the medications in order to support manufacturing these medications. So it does often get passed on to the consumer. The problem with these less costly kind of side ways to get the medication is you have no idea what you're getting. There's been studies out there that have shown that some of these non-approved indications have stimulants, have steroids, have other things in them that could potentially do a lot of harm. So for that reason, it's definitely not worth saving some money or saving that provider visit to kind of go that route.
Yeah, I don't know. It's cheaper and I can lose weight, so I don't know.
So semaglutide has been offered in certain med spas, but that's a direct to consumer type of advertisement where the person is really choosing that this is going to be the therapy for them. Whereas this medication was indicated to be a discussion with a practitioner, a healthcare provider. So what really is recommended is if there is interest in a medication like this to go to a healthcare provider to have the discussion. They'll do a full workup. They'll look to see if it really is a hormone imbalance that is likely causing weight issues, or discuss these lifestyle modifications, things that you could potentially try before going to the medication. Because if you get started on a medication like this, it could potentially be chronic therapy. For now, we don't know how long a patient needs to be on one of these medications to really have that sustainable weight loss. So we'd rather do it in a more natural way. Can we meet with a nutrition, a dietitian, somebody that even cognitive behavioral therapy to learn why the weight isn't coming off? Kind of having that teaching aspect of what should I be eating? What is the healthiest foods for that overall well-being that would also lose to weight loss? Also talking about how quickly we should lose weight. It's not healthy to lose a lot of weight very quickly. So kind of having somebody that is there to follow up with you to help with that weight loss journey. If it does come to that a medication is appropriate for you, that should be down the line after these discussions, making sure that you don't have any of those conditions that would make the medication dangerous for you. If a practitioner is jumping to the medication first without having these discussions, that might be a concern. It's definitely something that you want to do the due diligence of kind of making sure that it is the best therapy for you. If you do go to one of these med spas and decide that you're going to inject yourself with who knows what is actually in these products, it could be doing yourself a disservice. You don't know what you're getting. You may have had one of those concerns of risk for pancreatitis, that inflammation of the pancreas, that you could end up in a worse place by kind of jumping ahead and not going through the healthcare process of looking to see if this is an appropriate medication.
I appreciate
Sounds good.
you coming on. It was good information, and I appreciate
Yeah.
you being okay with my sarcastic nonsense. So
Yeah, no problem. Yeah, thank you.
take it easy.